So it is more common in males. Age group 50 to 60 years. 50 to 60 years. What is the most common symptom? The most common symptom, it is abdominal pain followed by weight loss. So this is abdominal pain followed by weight loss. Clear? And these patients are having abdominal pain, weight loss. Apart from that, patient also present with palpable mass. So there is palpable mass. In one of the latest exam, this question was asked that what is the definition of significant weight loss? So how much weight loss in 1 month? Yes, 5%. How much weight loss in 6 months? More than 10%. And how much weight loss in 1 year? More than 20%. So definition of significant weight loss. In a latest exam, this was asked. So how much weight loss in 1 month? How much weight loss in 6 months? And how much weight loss in 1 year? You have to just double the weight loss. So in 1 month, more than 5%. In 6 months, more than 10%. And in 1 year, it should be more than 20%. Clear? What is the most characteristic symptom of liver disease? That is fatigue. So patients who are having liver disease, they have fatigue and anorexia. So there are certain non-specific symptoms, especially if the patient is having advanced malignant disease. What? Anorexia, fatigue, lethargy, weight loss and nausea. So anorexia, fatigue, lethargy, weight loss and nausea, these are the non-specific symptoms. Second, sometimes patient is coming to you for the first time. What? Patient is having unrecognized cirrhosis and there is what? Hepatic decompensation. Or second situation, patient is having mild cirrhosis, but if there is development of HCC, what happens? There is hepatic decompensation. So certain patients are coming to our emergency with hepatic decompensation. Hepatic decompensation. If patient is having mild cirrhosis or patient in whom there was unrecognized cirrhosis. Now you tell me, hepatocellular carcinoma, it is a hypovascular tumor or a hypervascular tumor? It is hypervascular tumor. It is exclusively supplied by which artery? By the branches of hepatic artery. So whenever you are putting your stethoscope over the tumor, you can hear audible bruit. So in what percentage there is audible bruit? In 25% patients. In what percent patients there is GI bleed? GI bleed occurs in 10% patients. Tumor rupture, it is rare. It is seen in 2 to 5% patients. If you remember, we discussed hepatic adenoma or liver cell adenoma. How much was the risk of tumor rupture in hepatic adenoma? 30 to 50%, means almost 10 times. There can be jaundice due to biliary obstruction. In what percentage? Jaundice due to biliary obstruction in 10%, and paraneoplastic syndrome, just like RCC, it is seen in less than 5% of patients. In NEET SS, one of the common question is, what are the paraneoplastic manifestations related to RCC and related to HCC? So in HCC, most common manifestation is hypercholesterolemia followed by hypoglycemia. So the most common paraneoplastic manifestation, that is hypercholesterolemia. But whenever this question is asked in exam, hypercholesterolemia is not mentioned. So what you are going to mark? Hypoglycemia. This is second most common. Clear? There is erythrocytosis and these patients are having hypercalcemia. So these are paraneoplastic manifestations in patients of HCC. And we already discussed what is the most common site of metastasis in HCC. It is lungs. Most common site of metastasis, that is lungs.